Good evening, everyone. What I'm planning to do is to take two sessions on questionnaire validation. We have already discussed questionnaire development in one of the earlier sessions. So we are moving ahead with the validation. And in this class, we are going to focus on pace and content validity. So when you are doing your own study or when you are reading a manuscript for your, say, journal club, this aspect as to whether the study tool was validated is a very important question which comes to the mind. Even in your institutional ethical committee meetings, when you present your protocols, you are asked whether the tool you are using has been validated or not. So, what does that actually mean? Or when you are reading the article, it is mentioned that the investigators have used a pre validated questionnaire, or they mention that they have validated their tool. So, how was that done? That is what we are trying to understand in these two sessions. So, before we go to validation per se, when you're using a questionnaire or when you're developing your tool, these are five possible, types of research questions or the tools you're trying to use to address the questions. Some examples we'll try and understand when exactly we need to validate our tool. So if we are collecting data on some observable, reportable, objective variables like age, whether the person is smoking, yes or no, or if the amount which has been spent for seeking healthcare or the number of ANC visits, so these are observable variables. So all you need is a very good questionnaire and good questions to elicit the objective answers here. So all you need to do is some pre-testing to be confident about the questions. Another scenario could be where you are measuring a latent construct. Now, I'm going to talk a little bit more about this idea of a latent construct. So, if the variable you're looking at cannot, the data on that cannot be obtained by a single question, and it is very, very subjective and abstract in nature, like, say, burnout, stigma, or the quality of life. So, there are um, many questions you need to ask to really come up with an answer for such constructs. You need to use psychometric validation techniques in these scenarios. Another scenario could be where you are using a composite index like the Human Development Index or the Deprivation Index or some other index you yourself want to develop for your study. So there the processes involved are very much different as mentioned in this table. So which indicators you want to include in your index, the normalization, what weighting you will use, what weights you're going to use for each of those indicators, and the robustness of your index is what you need to prove. Another scenario which we commonly know is where, say, screening or diagnostic tests you want to assess and validate. So there is in a cross-sectional study, in one point of time, you want to assess whether the person has depression, and you're assessing your screening tool against the gold standard. So you are well versed with this kind of scenarios where you are interested in validity in terms of sensitivity, specificity, ROC, and area under the curves, etc. Another, the fifth scenario is where you want to develop prediction tool. That is, you are collecting data, say all of it is objective in nature, but you want to come up with a risk score. For example, a risk score to predict pregnancy. So here it is futuristic in nature. You want to collect, say, the data at first visit, but you want to predict the risk of adverse pregnancy outcomes. So in this scenario, what you need to do is you need to assess the discrimination, calibration, and internal external validation of the tool you are using. So you should ask yourself exactly what is your tool doing, and accordingly you should identify what are the techniques which need to be used in your study. Are you getting me here?
Yes, ma'am.
So you do not need to do the psychometric validation. So when I'm talking of all these uh, techniques of validation, for example, the face validity or the content validity which we are addressing today, you need not do it in all scenarios. So this is specifically done when you are measuring a latent construct, which we'll be seeing in the upcoming slides. So uh, this particular aspect is what we are going to concentrate on today. So again, if you are going to include a latent construct in your study, one of the variables is a latent construct. You need not validate it always. So how do you go about doing a study in such circumstances? The first thing, of course, is to search literature and see if there is a pre-existing tool already there. If it is there, you should assess whether that tool is suitable for your population and in the language you want to use it and for the purpose for which you want to use it. If it is available, you can use it as it is. And the easiest thing is if that tool has been validated somewhere else, but it has been also validated in this in a kind of setup where you want to use it, and it has been used earlier in studies, then you should be confident about using that tool. However, if you find that there is no tool for the construct which you are studying, then you need to develop a new tool. Or you find the existing tool which has been developed in some other country and it has not been validated for the population you are interested in. You need to translate it, you need to adapt it or modify it and use it. Then, in all these scenarios, you need to validate the tool you are going to use. So, are you getting this point?
Yes, ma'am.
So these techniques of validation need to be used if you are, first criteria is you are studying a latent construct. And the second is there is no existing tool or there is an existing tool which cannot be directly used in your population. You are making some changes and modifying that tool. Then you need to validate it. So you cannot, develop your own tool and start using it, nor can you use some questions in the existing tool and directly use it without validation. So please remember these points. So just one scenario I'm telling you all just to come like develop this idea of the latent construct. So supposing your hospital wants to estimate burnout amongst healthcare workers. And supposing a resident takes up this task and develops this questionnaire with 5 questions, and each question is scored on a Likert scale from 0 to 4. So, do you feel tired after work? Are you happy with your job? Do you enjoy weekends? Do you think your workload is excessive? Do you sleep well? And these set of 5 questions on the Likert scale is administered to 500 healthcare workers. And he reports that the mean score of the burnout is 14.2 with a standard deviation of 3.6. So when this number comes up, the question which comes to our mind is, can we trust this estimate and what does this estimate mean? All these questions, all these 5 questions, are they the right questions for burnout? And do they cover all aspects of burnout? Are they really measuring burnout or are they measuring something else, say job satisfaction? And if I use some other questionnaire and some other set of questions which somebody says is associated with burnout, will I get similar kind of results? So burnout, is a latent construct, and these 5 questions we are trying to assess the level of burnout with these 5 questions. But until and unless we validate the questions, we do not know how much trust can be put on this score of 14.2. So, whenever you are using a tool and you report your results can be questioned if you are not in a position to ensure that you have used a validated tool. So, that is why it is very important that all the questionnaires and tools which you are using are validated. So I'm now actually trying to come up with the concept of the latent construct. So when you're looking at the variables, so when you want to answer your research question, you will collect data on many variables. Now, if you look at these variables which are mentioned from left to right, say weight, height, blood pressure, hemoglobin, pain, stress, burnout, compassion, quality of life. You will see that the ones on the left are easy to measure because they are objective in nature, and the ones on the left are difficult to measure because there is no single question which can capture the data for these variables. So the ones on the left are actually observable objective variables which exist physically and which can be directly measured, and one question is sufficient to obtain data on those variables. But these constructs, the ones which are there on the right, they exist theoretically, and you cannot get the answers to those questions with a single question. You will have to ask multiple questions because these constructs are not directly observed, they are latent, they are in the background, and you have to capture them through multiple questions. So a construct is usually a theoretical concept which cannot be directly observed, and you are going to infer about those constructs through multiple items or multiple questions. And the example of burnout, which we looked at earlier, is an example of such a latent construct. So whenever you are doing your studies, you will enumerate all the variables which are required to answer a research question. You should ask yourself, am I handling any latent construct? That is there any variable for which there is no objective way of measuring it? And I'll have to ask multiple questions to understand that theoretical concept. Then you know that that is a latent construct which you are dealing with. So when you are trying to collect data on a latent construct, you should really be in a position to answer the question, that is, what exactly are we wanting to measure? So when I want to say study a burnout questionnaire, I should know what exactly is burnout. So I should not ask what questions should be asked. So how do I begin, thinking about the latent construct? So ultimately, I want to come up with questions to measure burnout, but the approach is not to first ask what questions should I ask to understand burnout in my study sample. But I should first understand the theoretical concept of burnout, and for that, I have to review the literature. So, if there is a latent construct which is needed to answer your research question, and you know that you need to measure that latent construct, you need to review the literature and define that construct and describe it conceptually. That what exactly is that latent construct, and that cannot be done until and unless you review literature and talk with the experts in that particular field. So for burnout, if you read literature, you may understand that okay, in burnout there is emotional exhaustion, one feels drained, there is reduced motivation, there is mental fatigue, there is poor concentration, there is detachment from work. So all of these points are not burnout, but they are manifestations of the construct itself, that is burnout. So if I measure these manifestations, I'm going to get some idea of burnout. So until and unless I read the literature and I understand what are the different dimensions which help me to capture the idea of burnout, I will not be able to develop the questionnaire to collect data on burnout. Are you understanding?
Yes, ma'am.
Yes, ma'am.
Okay, thank you. So um, again, of these, it's a very simple question. The six variables which are there, which do you think are latent constructs and which are concrete variables for which you can collect objective data? Can you all answer this question? Like, which of these are latent constructs?
Burnout,
Burnouts,
stigma,
stigma, satisfaction.
satisfaction, quality of life.
Right. So the first four are latent constructs, and blood pressure and hemoglobin you can measure. So they are concrete variables. So when you are collecting data, if you are studying, say, stigma or satisfaction for, say, some health service, then you will have to need a validated tool to collect data on latent constructs. But if you are measuring blood pressure, hemoglobin, you need not validate those those variables or the tools which are used to measure those variables, right? So remember that if you do not use validated tool and you are not clear with your definition and idea of the latent construct, then you will not be able to frame your questions properly and develop your questionnaire properly. And then no matter what kind of sophisticated statistical analysis you do, your uh, results are not going to be valid and believable. So again, the point that you need to understand the need of validating your tool when you are measuring latent constructs. So you have your research question, you develop your questionnaire, you get your results. The question is always going to be, can we trust those results? If you say we have used a validated tool, then of course there is no a question about not trusting the results. So again, when you are reviewing the literature, remember that do not be in a hurry to write your questions and develop your tools. So many times the tools are already available, so it's good idea to search for the existing tools and see how they can be used. And then, of course, what is already known about the construct and developing the different dimensions and domains on which you need to collect data to get to know your construct. So, when you are doing your review of literature, there you need to understand what the construct is, what are the different domains. If there are existing questionnaires, try and identify those questionnaires because you do not want to put in your efforts and duplicate what is already existing. If there are questionnaires, there could be gaps which you need to refine. And of course, many times you need to obtain permissions from the authors who have designed those questionnaires, even if you are adapting an existing questionnaire before you start using it in your study. So, seeking those permissions in time is also very much necessary. So, for burnout, if you search literature, you will see that there are a number of tools which are already existing. So, you can see what are the domains which are covered in the existing tools, what items are common, means what kinds of questions are commonly used. And then, of course, if there is an existing tool, whether that tool is suitable for Indian healthcare workers. And if you see that there is an excellent validated tool already there, you would not really develop your own tool. And if it is a tool which has been developed in some other country, in some other population, do you want to adapt it, modify it? Is what something you should ask yourself. And if it's a major modification, then there is a need to validate your questionnaire. So when you uh, read literature and you decide, okay, I need to develop my own questionnaire, then you should know how to construct the items. Items means the questions. So before again jotting down the items directly, you should ask yourself, does this construct contain many domains? For example, in burnout, there are multiple domains, like there is emotional exhaustion, there is mental distance, means detachment, and there is cognitive impairment, which is reported in literature. So you say, okay, I can sense that one construct, but there are multiple domains. Now, within that domain, we have to frame effective questions. Now, this we have already covered in the last class, the do's and don'ts of, framing your questions. So, for each domain, there could be more than one question. So, you should then design your question or your items for each domain. So, you have to first read literature, understand the concept, come up with the conceptual framework, identify the domains, and then in each domain, you have to design the questions. That is how you develop your questionnaire. And you should be sure that you are covering all the domains. You cannot say there are 5 domains, but I will only cover 3 domains in my questionnaire. So your domain should be representative and cover all the domains which are coming under your construct. So this is another important point which you should remember. So again, for burnout, you have emotional exhaustion, emotional impairment, mental distance, cognitive impairment. So coming up with questions for each and every dimension you have identified is important when you are developing your tool. Again, this we have already seen that there are multiple concepts. So you have to ensure that you are covering only one concept in one question. Use simple language. Do not use any jargon. Be specific about the time frame for which you are collecting the data, and the response should be restricted to avoid the leading questions double negatives, and also when you're giving response options, ensure that they are appropriate in nature. So this we have covered in the last class. So when you are developing your questions and your questionnaire, again, remember that you have to first proceed with the review of literature and identify the correct domains and the questions. And then these are the steps which are followed for validation. So how do we know that your questionnaire works well? Okay, I have now developed questions for each domain, and there are say 15 questions for my burnout questionnaire. Now I have to really start validating the questionnaire. So the first thing actually to do is to do something known as an informal face review. That is, the research team, your research team should sit down and read the questions and see if they feel that the questions are okay or some edits need to be done. Then you do what is known as content validity. After content validity, based upon the results of content validity, you may do some revisions for your questions, which is followed by face validity. Then you do a pilot testing, you do construct validity, reliability, and then you do your criterion validity. That is only if a gold standard or an external criterion exists. So today what we are going to do is we are just going to look at the content validity and face validity of a questionnaire, which is going to help you collect data for your latent construct. So do you feel, any of you all feel you're doing your studies or your, you know, a thesis where you are handling a latent construct? Do you feel you are doing or handling any latent construct in your studies?
Evening, ma'am.
Yes.
I did one of the shorter studies in my PG days, ma'am. I did assess the emotional intelligence, ma'am. It had
Yeah.
4 different domains.
Yeah.
Yes, ma'am.
So you use a pre-validated questionnaire or did you develop your own tool?
No, ma'am. Pre-validated tool, ma'am.
Yeah,
Yes.
right. Correct. Anyone else has an example?
Yes, ma'am. Ma'am, I am studying, like my thesis topic is quality of life.
Yes,
So, in that also, like I got a pre-validated questionnaire, which is of WHO breath scale.
correct. Yes. So whenever you are dealing with these constructs, you will search for a pre-validated, translated questionnaire, and you can then safely, confidently use those tools. Now, supposing you are in a position where you need to validate your tool, what are these different types of validities? So first is face validity. Face validity means what? You want to assess whether the questionnaire you are using is clear, understandable, whether it is readable, appropriately worded, and correctly formatted. So the question you need to answer for face validity is, does the questionnaire look appropriate and make sense to the respondents? The second one is content validity. Here you want to check whether the items are relevant, whether they are essential, whether they need to be kept in the questionnaire, and whether all of them together they represent all the domains of the construct which you have identified through review of literature. So the question you're trying to answer with content validity is, have we included the right items, and are all the domains adequately covered with your questions? The third one is construct validity. Here you want to measure the theoretical construct, whether it is correctly measured by the instrument. That is, whether your items are measuring the theoretical construct you intend to measure. Also, you look at the internal structure and the expected relationships between the various variables, and whether those different domains can be added together or whether they should be kept separate. So those, what is the way you should construct or deconstruct your instrument, is what this construct validity is all about. So your EFA, CFA, all this comes under your construct validity. So here the question you are trying to answer is your tool really measuring what we think it is measuring? And the last one is criterion validity. That is, if there is an external criterion or a gold standard, does your tool, the results of your tool agree with what is obtained from the gold standard? So is there a good correlation between the two, is what you look at when you assess criterion validity. So these things are looking at different aspect of your tool. One is looking at whether the questions are clear, understandable. The second one is looking at whether the questions you're asking are relevant and essential and representative of all domains. The next one is actually very important, because the construct validity is where you are really looking at the fact whether your tool is measuring what it intends to measure correctly. And the last one is you're directly comparing your tool with a gold standard and looking at their correlation between the two. Are you understanding these different types of validities?
Yes,
Um,
ma'am.
Ma'am, I have a doubt in face validity and construct validity, like how they are different from each other.
Face validity is where you're just looking at the questions and you want to see whether the respondents will be able to understand the questions correctly, whether it's very clear to them or whether you're using any jargons, whether there are any double negatives, and whether the formatting, if it's a self-administered questionnaire, whether the formatting, the spacing, the place of the questions, the options you are given, whether all of that is okay. But in construct validity, you want to assess whether those questions which you are using are measuring the latent construct which you intend to measure. For example, the burnout questions, whether the questions are actually measuring burnout or whether they are measuring job satisfaction or something else. So you want to use some statistical techniques and prove that the tool is measuring actually what you want to measure. Are you understanding the difference?
Yes, ma'am. Yes, ma'am. Thank you, ma'am.
Yeah. So when we look at the actually in detail each of these types, you will understand it more clearly. So when you are measuring a construct, so first is, of course, I told you, first be sure that you are measuring a latent construct. Read the theory, check for domains. For each domain, design the items, that is the questions, and all of these items together are is your tool or your questionnaire, and then is the step of validating that tool. So first thing to do is the informal face review. That is, your colleagues or your research team sits down and just looks at the wording, the formatting. You feel something needs to be changed, you change it before moving ahead with content validity. So again, I'm repeating the same thing on the left. You can see the flow diagram which we have already seen. And once you have developed the questionnaire and you want to begin with content validity, that is, you want to determine whether the questions are really appropriate and they are the correct questions to be included in the questionnaire. So for content validity, the chief question you are trying to answer is, have I asked the right question? Because in content validity, you are assessing the extent to which the items which are included in the questionnaire are relevant. So there are three things you check in content validity. One is whether the questions are relevant, whether they are comprehensive, and whether they are appropriate for the construct and for the intended population. So this is what you have to do when you say that, okay, I have proved the content validity of the tool. So asking the right questions. If I have written 25 questions, say to measure burnout, are all these questions the right questions? Are they appropriate? Do they adequately represent burnout? So before I start using the tool for data collection, I have to undergo this, the tool has to undergo this process. So the three things which are there in content validity. One is relevance. That is, are these questions relevant? Means, are they the right questions? So I feel emotionally exhausted after work. So this, if this, sentence is there and you have put it on a Likert scale in your tool, the question which needs to be answered is this a relevant question for burnout? The second component of content validity is essentiality. That is this question necessary? So what happens is there are, say, 25 questions in burnout, but there are 5 questions which are measuring the same thing. Means there is the questions are redundant. So you can say instead of 5, I can ask just 2 questions to capture that domain, or 3 questions. So I do not have to repeat or use more questions for a particular domain. So the question whether it is relevant is different, and the question whether it is essential or necessary is different. So whether I want to keep this question, or if I drop this question, it will not make much of a difference. That is what essentiality tells us. And the last aspect of content validity is representativeness. That is, have I covered all the domains? Have the questions covered all the domains adequately? Or is there something missing and I have to frame new questions to capture a particular domain? So these three are very separate or different from each other. Do you understand these subtle differences?
Yes, ma'am.
So if you are able to prove that the questions are relevant, that they are necessary, and that they all represent all the domains of the construct properly, then you can say that you have proved content validity for your tool. So when you're looking at content validity, you're looking at relevance, you're looking at essentiality, and you're looking at representativeness. And you have to then calculate these different measures. So you have for relevance, you have the item related CVI, icons B, and modified kappa. For essentiality, you have the content validity ratio, and for representativeness, there is domain mapping blueprint and expert review, which is more qualitative in nature, not much of calculations or statistics involved there. So we are going to see actually how to, calculate these different measures for content validity. So the content validity is usually done by experts. So you have to have a panel of experts for content validity. So who can be the experts? They can be subject matter experts, or people who have been trained in questionnaire development, or who are experts and for that particular construct in, say, practice itself. So if you are studying depression, then might be a psychiatrist or a psychologist, or somebody who is expert in a research methodology can be included in your panel. So for burnout questionnaire, you could have a psychiatrist, a clinical psychologist, occupational health specialist, or community medicine expert, nursing educator, health administrator. So you should also mention who the experts are who have participated in content validity. So approximately, usually it is recommended that 6 to 10 experts should be there in the panel, and it's ideally should be a heterogeneous group, so that they bring different perspectives to the table. Consider their expertise also. And then the cutoffs for the various statistics you come up depends usually on the number of experts. So that is also very, very important. So again, numbers, it's not just the numbers, but the quality of the expert judgment, the quality of assessment is also important. So one has to be very careful in choosing the experts for your panel. As I'm moving ahead, if there are any questions, you can jot it down in the chat, and we'll come back and try and answer them in the end. So for your content validity, remember that you do not depend on the respondent. So you do not choose a study sample and do content validity. Face validity, you are interested in doing in the respondents. That is people whom you are actually going to study later on. But for content validity, you have to do it with experts. So you have to design your tool, or your say a form for content validity. So for burnout questionnaire for Indian healthcare workers, you will have to design your tool. So you will have to say, dear expert, whatever the name of the expert is, inviting them to perform the content validity of this newly developed tool, and you will have to instruct them that assess each question, each item for its relevance in each domain, and we are going to use your responses to calculate all of this. And for the relevance, this is the rating scale. So usually you say that for each of these items or questions, the expert has to mark and rate whether the item is relevant or not relevant, somewhat relevant, quite relevant, highly relevant. And then you're going to use those responses to calculate the various measures of content validity. Along with this, you can also keep a option of some comments or suggestions from the experts. Apart from this, if they want to mention that there could be some additional questions which could be added, or something else, some remarks they want to give, you can keep that option in the tool you are developing. Are you getting it here?
Yes, ma'am.
So if you have, say, 6 experts, you will have six such forms in which you will mention exactly what you want the expert to do, and you will place all your questions with the Likert scale. Usually it's the 4-point scale. And if the domains are there, you will mention the domains also very transparently. And you want inputs from the experts, which will help you to calculate these various indices. So this is what is to be done for content validity. So again, apart from that, you may have some open-ended question. So because you are also interested, say, in the representativeness of the questions, you can ask whether all the domains are adequately covered, or again triangulate it with some other questions like, do you feel something is missing, or there is a redundancy or in the questions. So some such open-ended questions can also be added to address other aspects of content validity. So the experts are going to receive an invitation to participate in performing the content validity. They have to be given all the definitions of the latent construct, the different domains, the different items which are there. All the instructions should be clearly mentioned. The rating scale, which is usually from 1 to 4, is there. And then there should be space for comments. Remember, the experts are not evaluating the grammar or the meaning. They have to evaluate whether the questions are relevant or not, which is the core thing you are assessing when you're doing content validity. So when you are looking at the content validity, this rating on the 4-point scale is done where the experts must decide whether the item is relevant or not for that particular latent construct. Now, why do we use this 4-point scale? Because ultimately we want to convert the 4-point scale into a 2-point scale. So 1 and 2 are usually clubbed together as not relevant, and 3 and 4 are clubbed together as relevant. And you can do the further analysis using this binary coding. Means that for each item, for each expert, the response has to be converted from the 4-point scale to binary coding. I'll show you how we do this. So you have, say, question number 1. You have 6 experts who are reviewing the question number 1. So they are giving score on the Likert scale for first question. So the scores are 4, 4, 3, 4, 3, 4. I am going to recode each of these into a binary code of yes, relevant or not relevant. So relevant is 1, not relevant is 0. So 4 becomes 1, 3 becomes 1, and 2 and 1 score becomes 0. So for the question number 1, what happens? All the experts have scored 4 or 3. So all of these become 1. So the total for question number 1 is 6. Are you getting me here?
Yes, ma'am.
So we are just looking at question number 1. We are looking at the Likert scale. So here I told you earlier that this is the scale which is being used. So all for question number 1, this is supposing question number 1, all of the experts have coded either 3 or 4. And I'm recoding 1 and 2 as 0 and 3 and 4 as 1. So all of these 6 experts have coded question number 1 as 1. And if I then sum up all of them together, my sum for question number 1 is 6. So when I calculate the item level content validity index, that is the ICVI, it becomes 100%. It means 100% of the experts have considered this question to be relevant for this latent construct. Understood?
Yes, ma'am.
So for each item, this is item level content validity index. For each item means each question in the questionnaire, I am going to calculate a item level content validity index. And I am going to be able to say what percentage of the experts are thinking that this question is relevant. So that is item level content validity index. You can also calculate the scale level content validity index, which is the average content validity index. So here the points, there should have been decimal points here, they are missing here. But here what happens, supposing there are 8 questions, right? So in the 8 questions, for each question, I have calculated the item level content validation index. So I have to average all of the item level content validity indices to get the average. So if I sum this up and take the average, that is divide by 8, I get the scale level content validity index, which is the average. So it tells me the proportion of the items with 100% expert agreement. So I can calculate the item level content validity index as well as the scale level content validity index, and I can make a comment upon how valid each item is, and overall the scale, how valid the entire scale is for measuring the latent construct. Are you getting me here?
Yes, ma'am.
Yes, ma'am.
Now, as we are looking at the average, similarly, you can also find out. So this is just the average. The proportion of, if you want this proportion of items with 100% expert agreement, you have to calculate this. That is the scale level content validity index UA, which is the proportion of items with 100% agreement. So I have these 8 items. See, this is actually a hands-on exercise. So sometime this year, uh, we will, in our department, we will try and conduct a university seminar where we will try and do hands-on exercises. But just to understand the concept, here it is just the average. That is, I sum all of ICBIs and divide it by 8 and I get the average. For the UA, what do? I take only the ones where the ICVI is 1, where it is 100% and divide it by the number of items, and I get the proportion where the expert agreement is 100%. So the average tells me the average agreement, while the UA one tells me the proportion with perfect agreement. So these two things are telling me different things, but they are part of content validity. Are you understanding this? Agreement, I think it's universal agreement. I'll just confirm it and tell
Okay,
you
okay. Thank
at
you,
the
ma'am.
end of the class. Yeah.
Yes, ma'am.
Now, this cutoff value for the content validity index. So, what are the cutoff values for? So, this usually depends upon the number of experts who are doing content validity. So, there are different authors who have recommended different cutoff values. So, you can use the references and accordingly use a cutoff, but you can see 0.8 is a safe cutoff for your content validity indices, both ICVI as well as your scale level content validity index. So one point is whether the questions are relevant. The other aspect of content validity index is whether they are essential or whether they are redundant. Whether the questions are measuring, many questions are there measuring the same thing. I can drop some. They're not, all of them are not necessary. So that also can be assessed in your content validity index. So here, again, you have to develop a similar kind of a tool. But instead of asking whether the question is relevant, you have to ask whether the item is necessary. So whether the item is necessary or is essential, and this idea was developed by Losch, and this is known as the Losch question. Is this item essential for measuring this construct? So your content validity indices are measuring whether it is relevant, while the content validity ratio is measuring whether it is necessity. And this is on a 3-point scale. So the experts have to choose whether the item is essential or not. So if your 6 experts for a particular item, they say question number 1, they say that the 4 experts say that it is essential. One says that it is useful but not essential, and another says it is not necessary. So the number who are rating is at essential, it is essential are 4, and the total experts are 6. So these two numbers are needed to calculate content validity ratio. That is, how many experts are saying it is essential and how many total experts are included in your panel. So this is a formula for content validity ratio. So you have the number who are rating essential minus the total number of experts divided by 2 divided by the total number of experts divided by 2. So this gives you, say, a content validity ratio of 0.33. And then depending upon the number of panelists, there is a cutoff value for content validity ratio. So you can see that for 6, you require a very high value. So if it was question number 1 and you are getting a content validity ratio of 0.33, then probably it means that that item can, or that question can be dropped and it is not essential. So in this way, you can reduce the burden on the respondent by identifying the questions which are not necessary for developing the correct tool. Are you getting me here?
Yes,
Or is it
ma'am.
complicated? So I'm hoping that you're understanding the different indices you have to calculate when you want to report your content validity. Another index is the icons value, the icons V. Now here we want to assess how strongly do the experts agree. So instead of converting the four uh, options which are there on the Likert scale into two, you retain them as the four options in icons value. So again, the earlier questionnaire where you were looking at relevance is what icons value is dealing with. Instead of the binary coding, you are retaining the four options. So you are trying to retain the granularity of the options, and you want to comment on the strength of the expert agreement by preserving this original 4-point rating scale. And then there are again cutoffs to interpret the icon's value as excellent, good, acceptable, or whether it needs any revision. So again, an example, you have a particular question and these are the ratings 3, 4, 3, 3. These are the ratings which are given by the experts. So you have to use this formula for the icons V. So you have R minus 1 means all of these ratings minus 1 and their summation in the numerator. The number of experts multiplied by the number of response categories, that is, which is 4 response categories which were there, minus 1. And when you do your calculations, you get your value as 0.78. So if you look at the table, you will see that this is an acceptable threshold. So when you look at the granularity, when you are retaining the on the 4-point scale, still you will see that question number 1 is acceptable. So this is a little different because instead of binary, you are retaining the 4-point scale. And then, of course, you have the modified kappa, which is also another measurement of content validity. So how much of the agreement in the ICVI was beyond chance. So you all know what kappa statistics is. So this is using the same concept, that is, whatever agreement was there, you want to find out how much of the agreement you have calculated is beyond chance. So if you toss a coin, there is there is a half percent or half chance that you are going to get heads or tails. So when you are getting some particular value as your ICVI, you want to find out how much of that value is beyond chance. So this is modified kappa. So you want to adjust the value beyond chance agreement, and that is what you do with your modified kappa, and this is the formula for ICVI. So what you have to understand is that if you want to do content validity, you have to calculate and report all these different values. So modified kappa, again, you have to do it for each question. So you have to mention the value of ICVI for each question and the probability of chance which you get using this particular formula, which depends upon the total number of experts and the number of experts who have rated the item as relevant. And once you use the formula, say you have your ICVI as 0.67 and probability of chance as 0.234, then you get the chance corrected content validity agreement statistic, which is your modified kappa. Again, there are cutoffs which tell you to make an interpretation whether it is excellent, good, fair, or poor. So if you get a poor or a fair interpretation for modified kappa, you may have to review the wording or look at what the comments the experts have given and revise the questions which are there in your tool. So you see that there are many things which need to be done when you're doing content validity. So I'm just summarizing all of the indices which need to be reported for content validity. So if I'm looking at the item level content validity index, you can see that I am looking at, do the experts agree that this particular question is relevant? If I am looking at the average, I am looking at the overall content validity of the entire questionnaire in whole. If I am looking at the UA value, it is the unanimous agreement on the scale, that is the proportion of items with 100% agreement. So I think it is this unanimous agreement. UA is unanimous agreement.
Okay,
Then you
ma'am.
have this
Yes, ma'am.
ratio. Yeah, the ratio which is talking about uh, not merely the relevance, but whether this is essential, whether it is necessity. So the necessity part is addressed by the ratio. The icons V is telling me the degree of agreement. This is just telling me the agreement, but when I am looking at the granularity, it is telling me the degree of agreement, and what agreement is there beyond chance is what modified kappa is telling me. So these indices are different from each other and need to be reported for content validity. And then depending upon your interpretation, the values which you get, you interpret, and depending upon the interpretation, you have to act. So whether you want to retain it, whether you want to revise the question, or whether you want to drop it, so those kinds of actions need to be taken based upon the results of these kinds of analysis. So again, I've told you that after the expert review, you do your content validity, means you calculate these indices. So you form your panel of experts, you design your tool, you give them the tool, they have to look at the items, give the scoring, you get the input from the experts, then you do your analysis. Now you can do this analysis very easily in Excel. You also have some online tools which give you the results for these indices, some of them even with the 95% confidence intervals, which helps you to interpret them more confidently. And then based upon the results which you get, you have to decide whether you want to retain the question as it is, whether you want to modify it, or whether you want to drop it from your questionnaire. So usually the ones which you should report are the ICVI, the SCVI average, and the modified kappa. These two, that is the content validity ratio and the icons V, are optional when you are reporting the content validity. So are you with me till here? Because I think I will stop, because if it is getting too heavy, we will, because the remaining parts, that is your face validity, construct, and criterion, can be taken up later on. But with content validity, are you, first of all, tell me whether we should continue or stop. Then I will request.
Ma'am, we should stop because this is heavy.
Yeah, thank you. I understand. So I'll just stop first recording, and then we will discuss.